Yes, ma'am, you can start now.
Good afternoon, everyone, and a very warm welcome to yet another empowering edition of The Vibe Live, a hexalog. The Vibe, that stands for Women Inspire, Build, and Enhance, is a platform dedicated to fostering women's excellence. It brings together women doctors from diverse specialties to share knowledge, leadership experiences, and personal journeys that inspire growth and collaboration. There are four fundamental pillars that form the Vibe: the physical well being, mental health, financial wisdom, and professional excellence. Through conferences, forums, and mentorship activities, the Vibe strives to build a strong community of women professionals who uplift one another and redefine the landscape of healthcare leadership. I'm Dr. Ritu Johari, consultant diabetologist and metabolic expert practicing in the western suburbs of Mumbai. I have a unique background with a decade and a half spent in the pharma industry, working behind scenes of drug development, and now into clinical practice for the last half decade on the other side of the table, practicing diabetes, thyroid, and obesity. Besides clinical practice, I also contribute to research and medical writing as a co founder of RFED. But what brings me the maximum pleasure in sharing is the introduction of this unique initiative, The Vibe, as a founder of one of its kind platform. I'm blessed to be complimented by my husband, who's an orthopedic surgeon, and a family feels complete with a teen son and a 3-year-old daughter. With that, let me take you through our team vibe. Over to you, Dr. Lothika.
Hi, I'm Dr. Lotika Purohit. Welcome, Dr. Abha, for this interesting wildlife hexalog. I'm a diabetologist and a lifestyle medicine physician practicing in Colaba for the last 3 decades. Besides this, I'm also visiting faculty at the JJ Group of Hospitals and now part of the National Executive Committee of the Research Society for Study of Diabetology in India. My partner is Dr. Suresh Purohit, who's also known as the Sugar Doctor, and I'm a mother to an artist and an entrepreneur. Besides all the work that I like to do, I'm an avid Rotarian and I've been the president of my Rotary Club and many more things that are there. But this initiative is something that we all decided to start so as to support the other women physicians to, upscale and maybe share experiences with senior physicians. Now I hand over to Dr. Kavita Rane for her introduction.
Thank you, Dr. Lotika. Good afternoon, ma'am. Namaskar, everyone. I'm Dr. Kavita Rane. I'm a cardio-diabetes and obesity expert practicing for the past 15 years at Chembur. I have a clinic called Diabetes Total at Rani Hospital, Apollo Spectra, and in Lux General Charitable Hospital at Chembur. I also, in my hobbies, I love to dance, paint, draw. I love abstract art. I love visiting exhibitions. I love travel photography. I've had an exhibition at Jahangir Art Gallery. I love EDM music and I love golf. Over to Dr. Pranjali.
Thank you, Kavita, and good afternoon, everyone. I am Dr. Pranjali Shah, Director and Chief Diabetologist at App Diabetes Clinic. And I also handle internal operations in our Eye Heal. It's a complete eye care center. I love treating young diabetics and help them live longer and stronger. But if you don't find me in my clinic, you will see me doing farming, hiking, spending time with pets, learning about animals, their behavioral psychology. And I was a state level badminton player. So if you don't see me here, definitely you will find me either on the court or in the farms. Over to you, Dr. Rukia. Thank you.
Hello, madam. Good afternoon and welcome to the Hexalog Vibe here. I'm Dr. Rukia Surya Sheikh. I'm a diabetes, thyroid, and obesity specialist. I've been practicing in Mulund for a decade and a half. I have my clinic called as Blue Circle Clinic. And while not in clinic, I really enjoy working out. I love to play carom, and also these are the great companies and conversations which I really look forward to. Recently, I have started painting my way of adding little color and calm to this chaos of life. I'm married to Dr. Muzammil Sheikh, who's a medical oncologist, director at Nanavati Max, and I've been blessed with two daughters, one currently in grade 10. and the 1 in 6. So I'm really excited to be here today with such inspiring women in medicine to learn, to share, and grow together.
Wonderful. So you've seen our speaker here. We have Dr. Abha Nagral with us. Today's Inspiring Vibe Live celebrates the remarkable journey of this pioneer in hepatology and liver transplantation in India. So proud of you, ma'am. From building transplant programs to championing liver health awareness and child-focused advocacy, she shares lessons on leadership, purpose, and creating impact beyond the clinic while navigating excellence as a woman in a very demanding specialty. With over 3 decades of leadership, being amongst the very first few in the field, director of gastroenterology at Jasloke Hospital, a TEDx speaker, a founding trustee of the Children's Liver Foundation, her work extends far beyond the hospital walls. Her journey is one of clinical excellence, compassionate leadership, and unwavering purpose. And today, we celebrate her impact as a woman who has built systems, changed lives, and continues to inspire generations. Welcome, Dr. Abha Nagral, ma'am. You are a perfect role model for the women of today. And a quick word from you, ma'am. First question: how did you feel when you heard about being called on this platform? I know you run very busy, so we're really grateful to have you here. But just a quick bite from you of your first feelings. No, you're on mute.
You're muted.
Okay. I must say that I looked up Vibe, and I think your mission is really worthwhile. It's going to be a source of inspiration for most women, and not just women, but I think it has the ability for transforming lives of people around those women if they were to follow you. So I think great job and keep it going.
Thank you so much, ma'am. That is really motivating to come from you. So with that, I would move on and pass on the baton to Dr. Lotika for the first segment.
Yeah. So I'll be speaking about the first segment, the foundation, understanding the gut-liver connection. So basically, hepatology is one of the fields that has seen
Hmm.
Uh,
Can't you?
Uh, in earlier days, the career choices for women were very limited with doctors and lawyers. How did your calling lead you to this specialized branch? And what were the influences? Was it parents or was it your friends or mentors or something?
Yeah, so just to start off, why a doctor in the first place? My mother was a nurse, and my father had a heart problem since the age of 35.
Mhm.
So she was always concerned and worried about his health. And I just thought it natural for me to become a doctor so that after her, I could take over his health. Of course, it's another story that I did not become a cardiologist, and my interest went towards gastroenterology. During my medicine days, most of my training has been at the KEM hospital. And during my medicine days, we were asked to rotate through various specialties. And gastroenterology was one such specialty where we had Professor S.R. Naik. He was a person who had come from PGI Chandigarh, and he was extremely inspiring as a person. He would, for a patient who came with hematemesis, blood vomits, he would come and be there. He used to stay in the same campus. So even before the resident reached the patient, he was there. So he was a very inspiring role model. And then we had doctors like Professor Shanti Swarup, who was at Tata then, and he would come for rounds there. Now at the Mayo Clinic, and Dr. Patrick Kamath, again a hepatologist at the Mayo Clinic, who would come and round there. So all of them really inspired me to take up gastroenterology. Now, why specifically liver within gastroenterology? It's because at KEM was known as a liver referral center. So we used to have many patients coming for liver disorders from all over. And we realized that though there's so much of liver disease all around, often we were not able to offer any long-term treatment for them because there was no availability of transplant.
Mhm.
And that is when I decided that I need to get further training in liver and transplant specifically from abroad because there were hardly any centers in India those days. This was in the
Mm.
mid-late 90s. And that's when I decided to go abroad. I got scholarships to go to the Royal Free Hospital and Mayo Clinic and learn about liver transplant. And that's how I got into hepatology, so to say.
Oh, that's wonderful. Yeah, it does remind me of the times when I used to accompany patients to go to KEM when I was a resident at Nair. And yes, KEM was a fantastic center, though, I mean, whatever limited resources, but I think in those times, KEM itself was a great center.
Yeah.
So
Yeah.
you have been associated with an array of firsts, whether it's the liver care program in India or the first successful pediatric liver transplant in Western India. Could you share how it was what was the thought about walking these unventured paths and what were defining moments that you could recollect of this journey?
Yeah, so at that time it wasn't easy.
Mm.
But as I said, that became kind of my passion. I also got exposed to many rare disorders at the Royal Free Hospital. Some disorders like Gaucher disease, Wilson disease, which we had rarely seen or probably
Mm.
seen but not being able to diagnose when
Mm.
I was at KEM. So
Mm.
the first thing I remember is when way back in 1998, the first liver transplant was performed. This was a child uh, who had what we call a hepatopulmonary syndrome. She
Okay.
had chronic liver disease, and she had this severe clubbing and cyanosis. She was all blue, and that
Mm.
was actually coming from the liver. You would normally think of
Mm.
heart and lungs as a cause of
Mm.
low oxygen saturations. So she actually, within a week of transplant, had normal oxygen saturations and became perfectly well. And that was like the moment which we thought that this is what we really need. And there's a huge, huge need. Earlier, it was alcohol liver disease, and
Mm.
now it's becoming more and more what we call non-alcoholic fatty liver disease or
Yes.
metabolic syndrome related fatty liver
Mm.
disease.
True, true, very true. So, looking down behind the memory lane, did the word gender women ever create a barrier for you?
E- As much as you would want to say yes, I would probably say no. Uh,
Mm-hmm.
uh, because I think I was fortunate to go to the Royal Free Hospital. Now, most of you may know, I might have heard of Dame Sheila Sherlock. You know,
Yes, of course.
she
Yeah.
was the one who set up the first liver unit in the world.
Wow.
And
Wow.
so woman who set up the first liver unit in the world. And I had the fortune to be there and be with her when I was training at the Royal Free. Then
Okay.
when I came back to KEM, I had Dr. Shobna Bhatia, another woman who
Okay.
was my guide. I was her first student. And our head of department was Dr. Philip Abraham, a very nice person who never made me feel that I was a woman and therefore
Mm-hmm.
could not be,
Okay.
treated equally. But having said that, I must say that as I came more and more into transplant, I realized that the liver transplant field was very male dominated
Okay.
and that it was not easy to get along with the liver transplant surgeons specifically.
Mm-hmm.
And but over the years, I've learned to be on my own and put my own thoughts forward, especially things like this patient does not need a transplant.
Okay.
So yes, and that has been not easy, but I think I
Mm.
have kind of reached a balance there.
Okay. Well, that's so nice. It's been really nice talking to you. Now I hand over to Dr. Kavita Rani for the next segment.
Yeah. Thank you, Dr. Latika. Good afternoon, ma'am. So, a modern lifestyle, modern disease, a gift of evolution. This is the next segment for us. Change is the only constant in life, and progression is usually considered positive unless it is studied for its pros and cons in entirety. With modernization in our lifestyle, we have received in tandem lifestyle diseases causing a metabolic storm. So my first question to you, ma'am, India is seeing a sharp rise in fatty liver. among non-drinkers, that is called MASLD, and even among children, irrespective of economic class. What exactly is driving this shift?
As you said, it's we've become westernized. Our eating habits have become westernized. We are looking at Swiggies and Zomatos and fast foods. There's we become more and more sedentary. So there's no much physical activity. We are mostly on our mobiles, laptops. So we are hardly moving around. So this whole environmental change, lifestyle in terms of our diet, the movement we make, and there is genetics. We know that the Indian phenotype, so to say,
Yes.
is mainly central obesity. Most of us put on weight over the abdominal area, and that is determined by certain gene mutations which we inherit. One gene known for this is the PNPLA3 gene, where the changes in those genes are responsible for us developing this kind of obesity, what is called central obesity. So I think it's a combination of our genetics, and I think the older generation, though they had that genetics, were protected because their lifestyles were much better. Now our genetics remains the same, but the lifestyle has gone for a toss, and I think that's probably responsible for this huge epidemic of what we now call MASLD, or metabolic dysfunction associated steatotic liver disease. And it's predicted that almost 1 in 3 Indians have this problem. So it's a huge, huge problem. Yeah.
Huge, huge, huge. Yes, that's absolutely correct. And people are recognizing it now. So, how do the gut and liver talk to each other, and why is this relationship central to overall health? Any earliest digestive warning signs that often indicate deeper systemic or liver issues?
So, how do they talk to each other? So, as we learn more and more about liver disease and the gut, we have realized that a lot of diseases, not just the liver diseases, rest with our gut microbiome, as they say. It is the bacteria in our gut which finally decide what diseases we are going to develop over a period of time. In fact, there was a study done where they found that they looked at the gut microbiomes of pregnant women. Okay, and they followed up their children. So basically, what the women were eating influenced their gut microbiomes, and finally, it got transmitted to the children who were born to them. And they found that those who had a bad gut microbiome, that it is their children later on in life who develop diabetes. And we know that diabetes and fatty liver are intrinsically related. 90% of diabetics would have a fatty liver. So that's the connection. So what happens is that if our gut microbiome is not good, which will be influenced by the food we eat. So all the wrong food will cause what is called gut dysbiosis, which means the bacteria in the gut are not good, and that causes a gut has a immunological barrier. It protects by not allowing the bad toxins from whatever kachra we eat to get into the blood. But once the food is not good, the gut becomes what is called leaky. So all these toxins get into the blood, and we know that from the gut, the main vessel which is taking the blood to the liver is the portal vein. So it's direct from the gut to the liver. It's the first level of filter. So this blood, which is not good, which is impure, so to say, gets into the liver and starts off a whole cascade of inflammation, which causes fatty liver. So this is how very intrinsically the gut is related to the liver.
Correct. Thank you for this deep, deep insight, ma'am, on the gut microbiome and the whole gut-liver axis. Liver is central in diabetes and metabolic disease, alias lifestyle diseases. What basic screenings would you suggest to apply for children, adults to catch this dysfunction early?
So I think if you are at high risk, which means if you have a mother, father, brother, sister, aunt, uncle, anybody with parts of the metabolic syndrome, which means anybody who is obese in your family, anybody who has diabetes, hypertension, heart disease, cholesterol issues, or even PCOS, obstructive sleep apnea, these are all part of the metabolic syndrome. Anybody in the family with that, you are at a higher risk. Okay, so that's one. So anybody with that or anybody who has any one of these issues, I think should get screened. Any obese person, any overweight person, and mind you, in India, we take BMI more than 23 as overweight and more than 25 or 27, you may say, as obese. So anybody with a high BMI, anybody with a large waist circumference should probably get screened. And that screening should start early. We have seen it is the obese adolescents who will become patients with cirrhosis in their 30s. So we have to start screening early. Ultrasound would be one, and simple LFTs, liver function tests, or if you want not to do the whole liver function test, just as a screening tool, I would just say an SGPT blood test would be enough. But I think this screening should happen in this subset of people.
True, true. Thank you so much, ma'am. The BMI that you mentioned, like that would literally capture more than 80% of our population itself in India being
Absolutely,
overweight. That is
absolutely.
the
Yeah,
whole issue right here. Thank you
yeah.
so much, ma'am. Moving on to the next segment with Dr. Pranjali.
Thank you so much, Kavita, and good afternoon, ma'am. So after this wonderful clinical discussion, now we would like to have your practical tips, ma'am. So we'll be talking about personality beyond profession, the gender balance. Uh, so this topic that resonates, I'm sure, deeply with many of us. Behind every accomplished professional is a personal navigating multiple roles, expectations, emotions, and we are under constant efforts to stay balanced professionally at the same time personally. So, ma'am, my first question to you is: you are an academically strong and focused professional with remarkable journey and numerous achievement. At the same time, you also share life with a partner who has a demanding job. So how do you balance when both of you has a demanding career? Then how do you manage your personal and professional life?
Yeah, that's a very difficult question, and I'm not sure whether we've been able to balance it well. Nevertheless, I'll give you my views. So, yes, inevitably, however much we decide not to have gastroenterology conversations on the dining table. Incidentally, my daughter just became a gastroenterologist yesterday. So, yeah, I mean, so now it's not two, but it's three of us in the family. So we very consciously try not to have these discussions at home, but it's not possible to keep away from them. But let me put it the other way. We try saying that, okay, now this is the period, 2 hours, no discussion. We have to consciously say that to ourselves, and then we stop discussing. But I think it's not a bad idea to discuss, because many things which we've not thought of during the rounds in the hospital, they come, you realize those things at home.
Yeah.
So it's not easy. And as far as how I have been able to manage, I think I've had a fantastic, and maybe I'm the lucky one, backup from home. I've come from a very liberal background, and my husband, extremely liberal person. So there's been no question of taking permissions, asking. I do exactly what I want. All of us do exactly what we want, and of course, with coordination with each other. But
Yeah.
we are just given, we're all just doing what we think is right, and there are no questions asked. So I think in that sense I have been fortunate. And whilst I was, the problem is that women, when they're starting their careers, especially as super specialists, and when you're wanting to start a family, the time just coincides. It's in your
Yeah. Yeah.
early to mid 30s and you're doing all this, and it's a big challenge. Like when I was abroad, I would find that gastro fellows would be working only 3 to 4 hours a day. And why? Because they had been given permission to extend their fellowship from 3 years to 6 years, and they could do a half day, so that they could manage their the children, the
Family
family
management.
also, which I
Yes.
thought was a great idea. And I hope there's something like this which can come here, because here we have family, but I think more and more people are moving towards nuclear families, and it's not going to be easy. But yes, we manage somehow. Yeah.
Yes. So what I guess, like setting the boundaries when you're with the families and team support, teamwork will be efficient when both the partners are having equally challenging job. So now moving on to the next question is about mental health today. It's very important aspect, and I feel it is under discussed aspect in as a part of overall well-being. So ma'am, in your field you're handling children, and you need a lot of patience, and sometimes it might be overwhelming. So in such moments, how do you find your inner balance, calm? And I've seen your posts also, like you also love hiking and animals. So do you think birding, trekking, that also helps you to cope up with your stress and restore balance?
Yes, very much. In fact, I am in a very high stress field. Our patients are very sick,
Yeah.
and when patients get transplanted, sometimes there are patients who don't do as well, and it can be very, very stressful. So yes, one is of course I took to birding when one of my very close friends, Alpa, took me to the Sewri mud flats to see the flamingos. And I said, wow, this is like 10 minutes from home, and all my life I did not know about this wonder over here. And from that day onwards, I took to birding. And so just when you are like that saturated, I just take off. Whenever I go for conferences, I look for a birding place around, a nature place around, and I make sure that I go there and cool my
Right.
mind and have some mental peace restored. Yeah, so it does help. Yeah.
Yes, yes, ma'am. Thank you so much, ma'am, for those answers. Ma'am, last question. Could you share one experience or story that moved you profoundly or made you pause and reflect? Any such incidents or a case that you can recollect and you remember in your life?
Yeah, so yeah, it's not a very fortunate thing. There was this lady during the COVID who had both her parents actually succumb to liver cirrhosis, and she was just in her early 30s, and she actually came with. She said, "I want to do a health checkup because I've got a strong family history in my." Both parents having this problem. Father, in fact, had a alcohol-related problem, and mother had this non-alcoholic fatty liver disease related cirrhosis. And we found that when she came, she already had not only a fatty liver, but she had cirrhosis, and there were an inoperable hepatocellular carcinoma. So, and we really couldn't help her much. And she'd just come for a health checkup. So, this question, which was asked to me earlier, that are there any signs? Unfortunate thing about liver disease is the signs come in too late. And this was a lady who just said, I want to come for a health checkup. She had no symptoms at all, no weight loss, nothing. And she was found to have a end stage liver disease with a inoperable malignancy. So in a way, it was extremely unfortunate that we could not help her, and I can always remember that case. But I think it was also something to keep reminding us that, what I said, if you have any high risk history, just get on with the investigations and follow up. You will not have symptoms. This myth which people have that if you have symptoms, you go to the doctor. Yes, I would say definitely. But if you have a high risk history, I'm not telling this to everybody, but a high risk history, and what we're seeing is this combination of alcohol. Youngsters now think it's very cool to drink alcohol, but a combination of alcohol and this non-alcoholic fatty liver disease, what we call MET ALD, is
Yeah.
probably the worst as far as the liver is concerned. So, just if you have any of these risk factors, get onto it. And if you have a fatty liver, please stop drinking. That's absolutely important.
Wonderful, ma'am. So, ma'am, what is the cutoff age? At from what age we should start screening? I'm just adding to my last question.
Yes, adolescence. I think because that's when in children, typically before the age of 10, you would not have any fatty liver.
Yes.
And if you have a fatty liver in a very young child, usually these are other genetic metabolic disorders. These are not
Okay.
the fatty livers as we understand. But from adolescence, I think if there's a strong history, uh,
We should
go
start
ahead and screen.
screening.
Yes, yes.
Thank you so much, ma'am. Thank you so much. And we should plan a birding and trip once together, because we
Sure,
also
not a
love this. Definitely, we would love to be
Yeah,
with you.
it could be vibe with me. Yeah, that could be great.
Yes, yes, ma'am. Over to you, Dr. Rukia, for the next segment. Yes.
It's been wonderful to hear these pearls of, such great clinical knowledge that you're sharing with us about how to go about such big diseases in a small ways, So that is fantastic. And healthcare has evolved when leadership dares to think beyond today. And in this segment, we are going to be talking about the future of liver care, the transformative leadership that you are already a role model for. So my first question to you is that, ma'am, the Children's Liver Foundation has truly changed the landscape of pediatric hepatology in India since 2011. And from your perspective, how has the awareness, early diagnosis, structured liver care evolved over the last decade? And what mindset shifts made that transformation possible?
Yeah, so how we set up the Children's Liver Foundation. So when I came back from abroad, I realized that there was hardly any knowledge, both amongst ourselves as doctors and the lay public, about liver disorders in children. And as you know, the liver disorders in children are a totally different spectrum from adults. It's much easier to diagnose diseases in adults, but in children, there are so many genetic disorders, so it's not easy. And as a person who was interested in liver, I once got called for a support group meeting to KEM Hospital. I remember Ward 1 of KEM Hospital, the pediatric ward. It was a support group meeting for Wilson disease. And I realized that this is such a treatable disease, and we need to, create awareness, because this disease, if picked up, even in the stage of cirrhosis, can be reversed, and we don't need to send them for transplant. Because there was hardly any knowledge, there were no pediatric hepatologists in the city at all in those days. That was the late 90s, early 2000s. Some parents came together, parents of children with liver disorders. Some of us doctors came together to found the Children's Liver Foundation. That was in 2011. And the whole idea was, one, to create awareness amongst pediatricians, amongst doctors, and also give some knowledge through our website, which is a very active website, on to the lay people. So we held a lot of meetings over the years, teaching pediatricians through case studies, and that is what people liked, and also conducting support group meetings for various liver disorders in children. And we also put up the latest, which has been published on liver disorders in children through our journal updates. So basically, and now we have started helping children with liver disorders financially. Like one thing we really feel very strongly about is children do get money raised through various, crowdfunding agencies to fund transplants. But once the transplant is done, there's nobody actually helping them for the drugs, for the investigation. So that's where they need help. So we don't fund transplants, but we help children for, the drugs and investigations. So the Children's Liver Foundation has grown and has evolved in its kind of purpose. We also do a lot of advocacy. For example, in 2016, the main drug penicillamine went out of the market, which is a drug for Wilson disease. So we asked the government why the drug Triantine, which was available in the West in the 70s, is not available in India. And we through lobbying with the pharma and the government, we got this drug available in India. So there's a fair amount of advocacy also, which we do. And now over the years, we do have trained pediatric liver specialists, and there is a much more awareness about liver diseases in children overall.
And it has taken a great number of years, and it's like, it's not built in a day. It has been happening over a period of years, where slowly this awareness and, getting the community together. So, ma'am, now looking ahead, when we look at 5 to 10 years ahead, where do you see gastrohepatology moving? Are we entering an era of precision medicine, or the microbiome targeted therapies, or AI-enabled diagnostics, or something even more disruptive that we aren't fully prepared for yet?
Yeah, so I think the answer is probably all three, So, I mean, AI is already looming large, and I think we cannot kind of shoo away AI. It's there. We are, everything is AI now, but I think we need to use it cautiously. And if you use it well, it can be a great aid. Gut
Right.
microbiome, according to me, probably would be the biggest game changer. You may be able to change your gut microbiome and not need transplants at all. You never know. So I think the big game changer will be the gut microbiome. And I think, therefore, our focus should be more and more on the food that we eat, because that is finally what is going to change your gut microbiome. It's also the
Right.
way you sleep. Are you getting enough sleep or not? That is going to
Right.
change your gut microbiome. So I think for me, I think amongst these three, though all three are important, it's the
But what
gut
about
microbiome.
precision medicine in
Of course.
gastroenterology?
Yes, of course.
We are
Precision.
going there, right?
Yes, of course.
I think, even as diabetologists, that we all five of us are here, it all goes back to the small, simple, basic steps of, getting your life simpler, getting the lifestyle easy, and, getting the sleep right, the food right. I think it's just the reason for every problem that we are facing today.
And the more simplified we want our lives to be, the more difficult it is for us to do that. That is the
Oh,
problem. The
yes,
simpler we want our lives to be, it's more difficult to do that. So we've got
right.
used to, I think, yeah, we have to downstage everything in our lives.
Yes, so actually, some of our patients, or some very health conscious people, when you really want to eat a simple, healthy food, and you walk out and you realize that a shopping mall or an airport would not have anything to offer,
Yeah,
you end up cheating because it's not offered unless you carry your tiffins everywhere, which I think we have stopped now.
yeah,
Earlier, it used to be.
you look at hospitals, you look at schools. Are they
Yes,
serving, if you're going to the canteen in schools,
right.
in hospitals, are you
Yes.
getting healthy food there? I mean, it starts from there. If there we can't serve healthy food, where else can we?
So,
You know,
ma'am, even health checkups at a corporate hospital and the lunch that they serve, that the patient is supposed to do a 2-hour post meal, and the food which is offered to them, I always know that there's going to be some percentage of higher blood sugar just because of the food that he's eaten today
absolutely.
there, which he doesn't
Absolutely.
take it every day.
Sure,
So,
yeah,
ma'am,
it is.
our question. You spoke on TEDx, which is wonderful, and your journey with Wilson's disease. It was not just academic; it was deeply personal and inspiring. So, if you had to distill that journey and into few core lessons, especially for the young and aspiring women doctors, what would those be?
Yeah, so two important lessons. I talked about how I got exposed to this support group on Wilson's when I came back. And I realized, so that was the first lesson, that, patients just don't need only drugs from you. They need much more. They need that support, and I think women do that better. That's my feeling. Yeah. That empathy, that understanding of what's happening in the family. I think we need to give them that extra time. And sometimes I just feel bad when there's a huge patient load. You cannot do justice to that. So I try and do other things to work around it. But yes, so they need that support, and especially like diabetes. I mean, you could have a great support group for diabetics. I mean, I see all of you are, managing diabetes. There is so much to discuss. I remember I was teaching, my father was diabetic and I am a pre-diabetic. Simple thing, I realized that we were injecting him at the same site every day and his sugars were not getting controlled. I just changed and I rotated the site for the insulin and his sugars got better. So, these small things in our day to day, which we forget to tell our patients, makes a big deal. Diabetics, are they being screened for a UPCR every year? And I see so many of them are not being screened. So similarly in liver disease, when they are on diuretics, how are they following their salt restriction? So basically listen to the patient. So there was this patient, we know that soya contains a lot of copper. And in Wilson's, we say low copper diet. So there was this patient who had major handwriting issues because he had a neuro Wilson's as well. He got better with treatment. And then he comes back and he tells me that, look, my handwriting has deteriorated again. So, and he kept telling me that this thing you gave me, this protein supplement you gave me, has caused the deterioration in the handwriting. And I kept denying it. And then he says, no, I'm convinced. And then I looked at it and it was a soya protein powder. So, the lesson I learned is listen to your patients. You may not have an answer for it, but go back and check. And I'm telling you, they are often right. So do not ignore or do not wish away a patient who is telling you that he has developed this symptom after eating this, after doing this. Go back and check. I think it really helps listening to your patient. So that's one thing I want to tell you.
Wonderful, ma'am. It's been amazing talking to you. And now I would like Dr. Ritu to take up the next segment. I think the future is in safe hands, ma'am. I'm so happy.
Super. So, wonderful discussion so far. So, I have the task of holding on to the audience asked questions, ma'am. We really are so happy today. We have a list of questions that have come up for you. And before I go into the questions, we have seen your videos when you talk about, how much alcohol is actually good, how much is not. But I think that is a pertinent question that we also see on, our chat today. And of course, we've seen your entire discussion videos on how the fatty liver, the non-alcoholic or the, currently the metabolic disease associated steatotic liver disease is having an iceberg phenomenon. So when you look at these educational initiatives, you really realize that there is so much to talk. As exactly you said, that we sometimes forget the basics. And just by talking a little bit, listening with a little more patience, you actually get to why there is no answer to the question that has been raised. So with that, man, first of all, my simple question is that how much alcohol is okay when it comes to a social drinking, because yes, we say social drinking is fine, but what is that limit that one should define?
So basically, if you have a non-alcoholic fatty liver disease, no drinking. That's the first. In fact, WHO says no drinking is safe
Not
drinking.
drinking at all. Yes.
So, but if you are fine, there's no fatty liver, I would say not more than one drink. And one drink is 30 ml. Some people would say 45 ml of spirits, which is your whiskey, vodka, rum. Yeah, which is equal to about 150 ml of wine and
Yes.
250 ml of beer. So people have this concept that beer and wine are safe, but in all this, they are all 10 grams of alcohol. So they're all the same in those quantities. So one unit, which is 10 grams of alcohol, max for a woman, and not more than 2 drinks for a man. But if you have an associated problem, then no drinking.
Then of course not drinking.
And women develop liver disease much faster than men. So they have
In
to
fact,
be
yes, I remember, ma'am, one of the videos where you had shared that women, the kind of visceral fat depositions that happen, women are more prone to get, the fatty liver disease faster with lesser amount of alcohol consumption as compared to men. And I think that is again another thing that should be, published, because of course we talk of the Asian Indian phenotype, but I guess the women thing is something that, we probably need to talk about a little more. And with that, ma'am, I think I would definitely want to urge our participants that do watch the video which ma'am has shown, because I really love the way you have shown, the glasses and how people relate with it, that, how to make your drink, how to ensure that, what has what, if it's poison, it's really poison. And the other question, which is quite linked, ma'am, as we were talking about childhood obesity now with the current environment, it's very difficult that, even as doctors today, we face that our children, when they come back from their birthday parties or their get togethers and maybe in college, they are getting into various beverages. So earlier we were only worried about the soft drinks, but now whether it is the Gatorades, the Red Bulls, and the so on and so forth, how do you see those in terms of today for the liver of these children?
absolutely no. They are absolute no. So soft drinks, no. All these so-called energy drinks are a complete
Yes.
no. Yeah. And
Absolutely.
there's this wrong concept that they give you instant energy and
Yes.
whatever. No, in
Just
fact,
marketing gimmicks.
yeah, that's marketing. And I think there's a good thing about food labels and all labels, which whatever you consume, just turn around and have a look at the label. And if the first 3 ingredients has sugar, avoid it. It's as simple. And if it has multiple numbers and alphabets given to an ingredient, it's an additive. avoid.
Hmm.
So I
Hmm.
think just go by this simple rule and avoid these things.
Very good.
Yeah.
Wonderful. Thank you so much, ma'am. Next question that comes up is we were talking about gut microbiome, and I'm really impressed because yes, this is something that I was following my earlier professor, Dr. Yagnik, where we were talking about that, the entire gut microbiota actually gets formed while the mother is pregnant and is, eating the food. So when we talk of gut dysbiosis or, something, I mean, today if I tell this to children or patients, they'll say, oh, we can't do anything about it now. So, in today's day, while we wait for some advances to come in, what is the role of the pre-probiotics in general population or in those with grade 1 fatty livers? Because we as diabetologists see a lot of patients with fatty liver grade 1.
Yeah. So, yeah, I know there's this big thing about having probiotics, and I see people consuming them for months and months. No, I don't think that's right. Probiotics are good for an acute diarrhea.
Mhm.
They may be good for what we call SIBO or bacterial overgrowth.
Right.
But specifically for fatty liver, I don't think we still have the probiotic which can change it. But I would say, okay, if you want probiotics, just have good yogurt or curd or good old dahi
Wonderful.
daily,
Yeah.
which will keep your gut good and clean. Yeah. So I would say that don't get on to probiotics to protect your gut and protect the liver.
Yes.
Yeah. We don't have still very good scientific evidence for that.
Wonderful. That's a very thorough understanding, and thank you for sharing that with us, ma'am. Because usually, we sometimes we hear something, and then from the hearsay, it kind of becomes like a blanket cover. And in India, that the first doctor that a patient meets is always the pharmacist. So you go to the pharmacist, he'll give you the truckload of medicine options, and then they will come and test your knowledge about it. Talking about the medicine overload or the pill pop culture, there is another thing that happens is the PPIs over abuse. So, a lot of times people will say, I have acidity, I have, this thing which is very chronic, and every day I'm taking Pan, or I'm taking Rantac, or I'm taking Rabiprazole. So, how do you see this affecting the actual gut health? Because we are talking about H. pylori. We know that H. pylori is one of the issues because of over PPI usage. So, how do you see this problem getting
Yeah.
sorted, and how should we take it?
Yeah, so I'm glad you brought this up because it's a very common problem.
Yes.
First of all, people call anything acidity in India,
Yes.
I mean, for us, acidity means somebody having, say, reflux or pain
Yes.
after food. But people will call gas acidity, they'll call constipation acidity, they'll call aches and pains acidity. So
Acidity.
whenever a patient comes to me and says, I have acidity, I first try to find out what does he or she mean by acidity. So assuming we are talking about the right indications for taking PPIs, like reflux is, you get retrosternal burning,
Yes.
and reflux, you get regurgitation sometimes.
Regulations.
Yeah. So PPIs should be given for 2 months. Okay. After that,
Understood.
it is as and when. But I think again there, find out what is the root cause of the reflux. Patient
Correct.
is eating food, having a big dinner, and within 15 minutes is flat
Going to
asleep.
sleep. Mm.
So unless he changes that lifestyle, keeping a
Correct.
gap of 2 hours between eating and lying down, his acidity is never going to go, and he's going to be addicted to the PPIs all his life. So
Yeah.
PPIs are not, they're very specific conditions where we say PPIs for life, but they should be not taken for more than a couple of months at a time. Uh, Problems with PPIs, what does the PPI do? Basically, it kills all the acid which is there in your stomach. Now, why is there acid in the stomach? It's needed for digestion of your food. And
Yeah.
so when you kill all the acid, what happens? The bacteria grow. So there is overgrowth of bacteria. You
Yeah.
can have some tumors, what you call neuroendocrine tumors coming
Yeah.
because of
Yeah.
long-term use of PPIs. You can have higher risk of infections, and especially in those with cirrhosis, it has been seen that they have higher risk of infections. They can
Right.
have higher risk of an infection called Clostridium difficile infection, which is often seen with antibiotics. And long-term PPIs are known to make your bones osteoporotic and weak. So PPIs long-term are a complete no-no. Complete no-no, and they are not as benign as
Yeah.
they seem to be. So I think it's very important to know that.
Thank you, ma'am. That really helps a lot for us as well as our audience, and also to propagate to our patients the right kind of information when we also prescribe these kind of drugs. The next question, of course, like I said, when we are looking at type 2 diabetes, we get a lot of fatty livers, and because these days there are a lot of camps happening, patients are aware. So usually we see the commonest thing that is done is the sonography. They'll have a tummy ache, they'll get a sonography done. Periods not come, they've got a sonography done. There is some package, they've got a sonography done. PCOS suspected, they've got a sonography done. And then the fatty liver has come along, as a benign diagnosis. And then they want to come and ask you, okay, what can I do, cannot do for the fatty liver? Now, just wanted to understand one, when this happens in a say, someone who does not have any other diagnosis, then what do we do about it? And then if we have this in a patient with type 2 diabetic, then do we do a fibroscan, or do we do a fibroscan routinely for every type 2 diabetic patient?
I think FibroScan, there's a FIB4 score,
Yes.
which is based on platelets and liver enzymes.
Yes.
So, there are values given. So you can do a simple blood test to decide. But I would say if you have a diabetic and a fatty liver, do the liver function test. And I think this kind of patient would merit a FibroScan. So anybody like this would merit a FibroScan. Now, the other thing I want to point out is, in early days, whenever there was a fatty liver, often we would say, the radiologist would say, "ठीक है, it's, कुछ नहीं है, normal है." But it's not normal, so don't wish away a fatty liver. Look at it carefully. And we often find that the ultrasound has limitations. It's a good screening tool. It will pick up a fatty liver. But if there is fibrosis or scarring happening in the liver, the ultrasound is not going to pick it up.
Is
So
not going to
that's
pick
where
up.
you need a fibroscan, which will tell you, because what are the stages? First, you have a fatty liver, then you have scarring or fibrosis, and then
Right.
you have cirrhosis. And then it's actually becoming the number one cause of tumors in the liver, cancerous
Absolutely.
tumors in the liver. So ultrasound is not going to pick up scarring. So you would need a fibroscan. And sometimes ultrasound just says fatty liver and you pick up as early cirrhosis on a fibroscan. So I think in this high risk, so anybody with the metabolic syndrome and a fatty liver, I would want to do a fibroscan.
Wonderful. I think that is very, very relevant. Thank you so much, ma'am. So another question now, I'm changing slightly on from the science topic to again the soft skill part. Your perspective quickly on a woman, like, would you look at women as emotional intelligence plus grit plus multitasking as a strength, versus, because exactly like you just said, earlier, that women have this multitasking, women have this emotional intelligence, right? Or you see women as a hormonal storm, has sometimes gender bias in patriarchal society that we live in as a limitation. So, what would you put your money on? The strength part or the limitation? What do you think? Which side does it weigh more?
Definitely the strength part. Definitely.
Wow.
Yeah.
Super. That's wonderful, ma'am. So we wrap up the audience ask question and we quickly now jump into the rapid fire. I think you've already been a very, very rapid fire for us already. But yes, there are some quick questions which we feel will be really fun time for our audience as well as you. We hope you enjoy it too. So this is going to be few quick one-liner questions. You can be instinctive, honest, and you can answer in the least amount of words or sentence that is possible. So let me shoot that onto you. Tea or coffee for the liver? What do you say?
Black coffee.
Black coffee. Okay. Then the next one. Intermittent fasting. Helpful or harmful?
So you're asking Dikshit or Divekar? No final word yet. I would say be cautious.
Wonderful. I think I like the word of caution. One food you strongly recommend for gut health and one that you advise against.
Curds for gut health, and sodas and soft drinks and all processed foods completely no.
Wonderful. One lab test or parameter everyone who's 40 plus should know about them.
SGPT.
Super. One myth about digestion or liver health you would love to permanently debunk or retire.
Just get it back.
Still working.
One myth about digestion or liver health that you would like to debunk.
Story again at home
colon therapy and gut cleansing is useless.
Thank you, ma'am. I think that is very strong and very much essential for our public. That is very nice. If a movie was directed on the liver as a hero, which actor do you visualize playing the lead role?
Amitabh Bachchan. He's had a liver problem and he has this attitude, मैं जिगर हूँ मैं हार नहीं मानता. So I think he's the one. Yeah.
Wonderful. That's super. As a hepatologist, ma'am, what would you have been? What alternate career would you see yourself in?
Maybe an environmentalist.
Wow. I love that one. Just to mention, I saw the snake photo and I was so much into it. I was telling Pranjali that, we should go trekking with ma'am on that. And last question. If you could swap yourself into an animal or bird for one day, what would you choose?
Bird can soar over the world.
Lovely, ma'am. It was an honor hosting this rapid fire. You have been flying through, whether it was your career, whether it's been, the liver transplant entire field. Being a woman, you've made a mark, and of course, you've added on to the jewels, the women who have created history in the field of hepatology. So the sharp, sincere, and authentic version, just as what the vibe stands for. So over to Dr. Lotika now for the closing.
Lotika, before
Yeah.
you close, can I just ask a few questions? I know
Sure.
audience, I did not type it there. I thought I'll take the opportunity. Ma'am, there are a lot of liver detox tablets which are going around, and milk thistle, curcumin, and so what do you have to say about them?
Yeah.
No proven evidence.
Okay.
Milk thistle for some chemo drugs has been used, some evidence on that. Curcumin, in fact, has been shown to affect the liver in a negative way. So I wouldn't say that any of these are evidence. The only so-called liver tonic we have today is black coffee. No milk, no sugar.
Okay.
Okay. So there are so many roots also, the dandelion root and so many roots. Patients come up with the liver dawai, which is
Yeah, so we discovered this patients taking Giloy during the COVID times, and
yes.
we actually proved that it caused liver injury in people who were prone to autoimmune disorders. So no roots and no herbs without good kind of supervision from people who are trained to give these drugs. Not
Ma'am,
otherwise.
green tea extract. I know
No,
you
not
said
at
black
all.
coffee, but
Green tea has been again shown to negatively affect the liver. No.
Okay.
Yeah.
Thank you. Thank you so much. Yes, Lotika, please.
Yeah, fine. So, Dr. Abha, it's really been very nice hearing about your story, your journey, and also learning about why liver is the main powerhouse of our body, and how we can probably prevent injury like cirrhosis, especially for the younger generation, and what needs to be done so as to they can seek adequate help, and probably of course prevent it. And microbiota, that of course is something that's very interesting. Madam, have you started FMT over here, or
Yeah, we do it
you
occasionally.
do it? Yeah. Okay, so that is also something that is
Yeah.
interesting for the future. So this has been very nice. My take-home message today is that patients need more than drugs. They need a support, and they need a lot of empathy, and we need to listen to our patients to really deliver good healthcare. So, Dr. Pranjali, what is your take-home message?
Yeah, so same, Dr. Lodika, is you should not jump to the conclusion. Listen to your patient, go back to the history, see what we have prescribed, and then again reconnect with the patient.
Yeah.
Okay.
I agree with both of you. This whole thing about just women are great at not just giving medicines to the patients. They provide much more. So empathy, the issue which we're definitely blessed with, getting that extra X is help there.
Dr. Kavita?
Yeah, I agree with all of you all what ma'am said. Listen to the patient first. It matters what they say. What we can't see is not exactly what it doesn't exist. And also she said spend time in nature, so I love that too.
Thanks,
Thank
Dr.
you.
So wonderful. I think from my side, a list of things that are already ready, but I've been talking for long. So I'll just say two, three things. One, I really love, ma'am, when you mentioned that, the environment which you've created, when you said, that your daughter is a gastro now, and, the way Sir has also been an iconic feature, and then still ensuring that, there is quite grounded nature at home. You're talking of subjects different from science, different from the liver, because now I can see all the three people talking liver and gastroenterology at home, but just getting to the core, probably using nature, probably trying to reschedule your life, or maybe, I don't know, reset yourself to be energized again, to go back to work and have a more fresh, mind to work on. And the second thing which I really like is get to the root of things. Sometimes we get on to treating just what is at the brink of it. It may appear as an acidity. So please understand what is the perception of the patient, because a pain can be subjective. Similarly, acidity can be subjective, and any symptom that the patient is mentioning, we really need to understand what it is and then treat it. So, thank you so much, ma'am, for those pearls of wisdom.
Yeah. Thank you, Ben. So, as we conclude, we would like you to join us to create the unique signature sign off that we have. Is we put both our hands together with the V, and at the count of three, we say, "Be the vibe." So, 1, 2, 3. Be the
Be the
vibe.
vibe.
Why?
So, thank you
Thank you
so
so much, ma'am.
Thank you so
Thank
much,
you,
ma'am.
ma'am. Thank you
Thank
so
you.
much,
Thank
ma'am.
you, ma'am.
Thank you. It was a
very,
pleasure.
very
I
Thank you.
hope
nice.
you enjoyed too.
Yeah. Okay.
Bye. See you.
Bye-bye.
Bye.